A malfunctioning temporary pacemaker is a true code blue waiting to happen. Troubleshooting requires a systematic approach, moving from the patient back to the generator. Here is a guide to identifying and fixing the most common pacing pitfalls. When the monitor shows a problem, check these components in order. Is the patient hemodynamically stable? If not, initiate a CLS CPR while troubleshooting. Ensure the pacing lead is securely locked into the extension cable and the extension cable is snug in the pulse generator. Is the pulse generator turned on? Is the low battery light flashing? Has the transvenous lead migrated? Check the centimeter markings at the insertion site. Failure to capture. Pacing spikes are present, but no QRS complex follows. The exit block. Current isn't strong enough to depolarize the myocardium. Increase the output, MA, to the maximum to see if capture returns. Reposition the patient, turning to the left lateral decubitus position can sometimes improve lead to wall contact. Check for electrolyte imbalances like hyperkalemia or drug toxicities that raise the threshold. Oversensing. The pacer is not firing despite a slow intrinsic rate. It thinks it sees cardiac activity that isn't there. Could be because it is seeing or sensing large T waves, P waves, or even skeletal muscle twitching like shivering. Decrease sensitivity, that is increase the millivolt number. This makes the fence higher, that is pacemaker ignores the background noise. Check for nearby electromagnetic interference like cell phones or ungrounded equipment. In case of undersensing, pacing spikes appear randomly, often falling on T waves, and can cause R-on-T phenomenon because pacer doesn't see the patient's own beats. The fence is too high. Increase sensitivity, decrease the millivolt number. This makes the pacer more alert to small intrinsic signals. If you are losing capture and the patient is deteriorating, use the emergency safety settings. Rate 80 to 100 beats per minute. Output, that is milliampere, set to maximum. Usually it is 20 milliamperes. Sensitivity set to asynchronous to the lowest millivolt value to ensure the pacer fires regardless of what it sees or senses. Be on the lookout for avoiding technical pitfalls. Battery depletion. Always tape a spare 9-volt battery to the back of the generator. Lead migration. Secure the lead to the skin with a wing suture and transparent dressing. Accidental turn off. Use the protective plastic cover over the dials or buttons. Microshock. Always wear gloves when handling the pacing terminals to prevent stray static from causing arrhythmias. That is, static electricity from your fingers can get conducted from the pacing terminals to the lead tip in the heart and cause arrhythmias. Daily checks are vital. Always document the capture threshold, that is the minimum milliamperes required to consistently pace. If the threshold has jumped from 2 milliampere to 10 milliampere overnight, your lead has likely migrated or there is increasing edema at the tip, predicting a failure before it happens.